and Therapy. My name is Glenn Bergeron, and I'm the president of the World Federation of Athletic Training, and I'll be your host for today's presentation. We continue to be pleased with the response to these webinars. We have over 200 registrants for this webinar, and I'm told that we have somewhere a large cohort from South Africa. So welcome, South Africa. It's awesome to have you here. Once again, we're partnering with the educationalist community, the newest committee of the National Athletic Trainers Association. And today's presentation is a sequel to our very first webinar. We're excited to welcome Dr. Paul Geisler back to the screen. Briefly, Dr. Geisler is a professor and director of athletic training and education at Ithaca College in upstate New York in the USA. He has been actively engaged as an athletic trainer for more than 30 years, and including the last 22 years as an AT educator and administrator. He has served on many of the NATA and EATA committees and currently serves as the inaugural chairperson of the NATA educationalist community. He's chiefly interested in the teaching and development and assessment of clinical reasoning in students and authentic, effective assessment approaches for AT education. So this is right up his alley. Today's presentation will be the how-to session as a follow-up to his first presentation. The first presentation was entitled Programmatic Assessment in a Remote World. And today's presentation is entitled Introduction to Item Writing and Microsoft Forms for e-Assessment in Athletic Training and Therapy. And so this will be more of the applied portion of the previous presentation. Before we get going, some housekeeping notes. First of all, this session will be recorded and uploaded on the World Federation of Athletic Training and the educationalist websites for future reference. Dr. Geisler's presentation will be approximately 60 minutes, after which time we'll allow 30 or more minutes for questions. And questions can be submitted during the presentation using the Q&A feature on your Zoom. We ask that before you post a question that you look to see about some of the previous questions, and if one of them is similar, just hit the like button, and that'll just give us a sense of popularity of that question, and then we can bring it up higher up in the order to make sure that it's being asked. Dr. Geisler will be asking you to respond to some poll questions throughout his presentation, and you're simply asked to click on the response, but rest assured that all the responses and the respondents are unidentifiable. Once the webinar is ended, you'll be sent a very short evaluation form for questions, and we would really appreciate a few minutes of your time to give us some feedback, as it helps us plan for future webinars. Also, you will be receiving a certificate of participation, all those who are online. Within a day or two, you'll get a certificate of participation sent out to you as well. Now it's time to welcome Dr. Geisler to the screen for his presentation. Dr. Geisler.
Thank you, Glenn, very much for that gracious introduction, and thank you, Oliver, the man behind the green screen over there in Oz, pulling all the right buttons and helping us pull us off technologically. Welcome to everyone from around the world. Welcome especially to those who were perhaps on my first webinar on programmatic assessment. It's very nice. I think it's a good measure of productivity and scholarly pursuit when there's a lot of follow-up questions and need for more. Given that best practices demonstrates that webinars should be kept to about 60 minutes, I try to do that, and maybe we had too much information on that, and then we're going to try and do that as well today. So item writing is the topic of the day. And then corollary with that is trying to use MS Forms to do so. So I'm going to do my best to deliver some important information, some really critical take-home information to you folks within an hour, and then I'll be around as long as needed to answer questions, and maybe we can have some good dialogue. With that caveat, I'm not necessarily an expert in this. I'm not a stats or numbers guy, and so part of item writing is psychometrics. It's a scary word for some folks, including me, but we will do a little psychometrics 101, the important things that you need to know if you've been habituated to using Scantrons before with the bubble sheets and getting that report back. Maybe like I was the first few times I used them, you pretty much just got the scores and took a gander at things and kind of went with the flow and didn't really pay attention to all that data and all those numbers that came back with it and what to do with it from a standpoint of making better exams, better questions, better items, therefore making your assessment purposes more valid. So what we're going to do today is talk a little bit about the basic constructs of Item Runner 1. Again, the title is Introduction. So if you have experience in this, formal training in this, maybe it'll be a little underneath your level. But as we get into some of the other later aspects, perhaps we'll be able to add a little bit to your skill set. Without further ado, let's see if we can't. Do this transition. Okay, so look good there, Ollie. We got the right screen up, and I'm showing the right thing.
You're showing us presenter view, Paul. So you might actually want to click into normal full screen mode on the presentation.
How's that?
Perfect.
Okay, so there's the background of me. Again, this will be available, and I'm more than happy to share anything within this presentation with the World Federation. It's all about dissemination and sharing and helping each other do our work better and creating a collective idea for progress. I have nothing to disclose. I do not own stock in Microsoft, not that I know of. Perhaps I do somewhere buried in my 401k, but I don't have anything to disclose or conflicts of interest, even though I'm using Microsoft Forms somewhat predominantly here towards the end. Today, what I hope that we gather is that we have a little bit of fun with making fun of ourselves, and I've embedded some comics like this, and perhaps from a standpoint of being a student or being an educator, some of these comics will harmonize with some of your experiences, perhaps maybe if you're a parent along those lines. But from a professional academic standpoint, I hope to display to you a better understanding of the parts and principles of item writing or writing questions for exams. Realize the value and utility of well-constructed multiple choice questions for assessment. Originally, I had in here extended match questions as well. I took that out on purpose, as you'll see, because it just got to be too much information. But during the Q&A, I hope maybe I can talk a little about extended match questions and their usability in parallel with MCQs, because that's what I'm doing in my own assessments. I'm using both. But we're going to focus on MCQs because everybody here is more familiar with those as a student and as an instructor, I'm pretty sure. I think real importantly, appreciate that higher level thinking, reasoning, and application skills, integration, synthesis, analysis, those types of things that we all value from a clinical standpoint can be assessed with sound multiple choice questions, something that I was ignorant of for a long time in my career. Again, as I said, we're going to get a little bit into the weeds with Psychometrics 101. Just cover a couple of the major points of interest that are important to understand when you redo a test, right? You make tests, 100, 125 multiple choice exam, and then you have that data, what do you do with it? And especially from a standpoint of if you're using summative assessment measures, if your program, either for requirement or preference, has a summative assessment exam, 125, 150 question multiple choice exam that students have to pass in order to graduate or be eligible for your board exams, right? It's really much more important if you're using these types of measures for summative assessment rather than formative assessment. So that was a lot of the focus of the last webinar. So that's the connection. And then finally, have a little bit of a lab to this towards the end, last third or fourth, to go into MS Forms and kind of give you some tricks and trades of things that I've learned in the last year, really, of how to use MS Forms to do things more efficiently and economically and practically standpoint. So Oliver, if you'd please launch the first quick strike poll. We have a couple questions that I'd like to get your feedback on, folks.
Okay, that should be launched. Hopefully everyone can see that.
Yep, there we go. So we got 3 questions to ask. Be as honest and candid as you need to be. They're all anonymous. Okay, 5, 4, 3, 2, 1. Hope you all had a chance to vote. And can we see the results, Oliver?
Yeah, I'll share those with you now.
Okay. Oh, great. So we're pretty split between novice and intermediate. We have one expert out there. Good. I can hand the reins to him or her when I get stuck. Do you have any formal training? Again, a lot more on the no side. And if you do have formal training, where'd it come from? Academic training degree. A couple people got some information at conferences and webinars. Very nice. 67%. So the majority don't have any formal training. My formal training, if you will, came from a great week-long seminar offered by the European Board of Medical Assessment, hosted by University of Maastricht Medical School in the EBMA. I went 2 years ago, fall of 2018, for a week, and we had spent a whole day on item writing and blueprinting. I highly recommend it. Again, I have no interest to protect or serve there, but a great course, especially if you're over there in the continent of Europe and can get there easily. So as a personal backdrop, just where we're coming from here, I'm German, I'm male, I'm from New England. Those of you who aren't from America don't realize New Englanders are fairly stubborn. So put all that three together, I'm a pretty stubborn guy in some ways. So I prioritize throughout my pedagogy and my assessment, I've always prioritized the clinical reasoning process, diagnostic reasoning, therapeutic reasoning in particular, and lately incorporating contextual reasoning, which is a hallmark of expertise, and then transferability, or the ability to integrate and connect different forms of knowing and knowledge. Example, anatomy to pathology, or anatomy to and biomechanics to an MOI, mechanism of injury, signs and symptoms to the pathophysiological process, etc. So trying to connect the basic and the clinical sciences together, I've always prioritized that in the way I teach and the way I assess. And then out of pure ignorance and stubbornness and laziness for years, I avoided multiple choice questions. I would have, 10, 15 in there, but I hated them. I didn't like them. And mostly because I did not think that you could assess clinical reasoning and clinical decision making. So I avoided them. I thought it was more black and white, low level type stuff. And then when I did do some, it's just my brain hurt to try to write questions and make them sound well in proper syntax and English and grammar, and then coming up with 4 or 5 responses. And I did what probably a lot of people do, is as you get tired at the end of the night and the exams to be given tomorrow, some of your questions have throwaway responses and you get silly and then you throw in bonus points. And then, even when you don't do that, I found that I made a lot of mistakes. And of course, you don't realize the mistakes until students come and challenge you on question X, question Y, why they got it wrong or why they didn't get it right or something to that effect. And then I started to see, wow, that was a really bad question. Or, yeah, I understand that actually could be right. You're correct. So I started to, kind of organically start to see how hard it was to make really good questions in responses. And then, so what I did for years, and my students can tell you this, is I used long open response problem-based exams, present a case scenario and ask for a differential diagnosis, then based on that, ask for what they would do history-wise, then based on that, what they would do assessment-wise, and all the way to physical exam and perhaps functional testing. And I was married to that mechanism because I felt strongly that it gave me the better ability to assess their reasoning process. And if I did it correctly, I also assessed their basic science, because there were questions specifically embedded in there about the anatomy or the physiology or those types of things. But as you can imagine, my final exams in particular took me hours, days, weeks to grade, and every year I would kick myself, and my wife would remind me how ignorant and stupid I was being, that I didn't change the way I assessed. So I lamented that grading time quite a bit. So that's the backdrop. And so when I finally started to learn more about the science and the art of item writing, I realized that I wasted a lot of time and did a lot of bad evidence-based practices, or lack of evidence really, for a long time. And that probably hurt my students in a lot of different ways. So that's my personal backdrop and why I'm really interested in this, and to sound a bit nerdy, having a lot more fun with it as we go on. So Ebel, even back, all the way back to 1951, right, has a great quote from a book. It's, "Item writing is an art, requires an uncommon combination of special abilities, mastered only, like other things, right, most things, through extensive and critically supervised practice. It demands and tends to develop high standards of quality and a sense of pride and craftsmanship." So, like a great painting, a great book, a great poem, it's not easy. It takes time. It requires a lot of mistakes and deliberate reflection and feedback and help to get really good. you know, we've probably all seen these memes that have gone around in email. There's some really funny ones out there nowadays on social media about live, you know, exams that have been graded. So we've all probably made some mistakes like this, and making an exam, or we just get tired and we throw a Gary Busey response in there or a Chicken's response in there. Again, we'll understand that in a minute, technically what that means. Or we've all had a good laugh when students have circled a non-logical, illogical distractor. So item writing, kind of diving in here. So we're going to roll up our sleeves right here and kind of get quickly into it. So there are a lot of things, a lot of terms, a lot of operational definitions that are of great import if you really want to get into item writing and psychometrics and learning analytics, and if you're doing summative assessments, again, I can't emphasize enough, you really should dive in deeper and understand more and more of this. The context of today's presentation, what I'm presenting, is not from a summative standpoint. You know, our BOC exam, the Canadian exam, the BASRAT exam, the RD exam in Ireland, and others that may have national licensing board exams, right? They have experts in psychometrics and item writing, and they go through all these processes at a painstaking level to make sure that the tests are valid and reliable and that they meet all these terms. From a standpoint of a class-based assessment, whether it's you know, a totally formative one where the measures, the outcome, the grade doesn't matter, it's purely for feedback or to gauge their progress, or if it's a midterm or final exam or something that is a little more summative, it has a little more weight or stakes to it. These are the ones that really dial in for the level of sophistication we're going to get into today. And a lot of people say that the most important element is content validity. In other words, does the test or the question at hand, you can apply it to either or, measure and sample of relevant learning objectives or outcomes. So for that class or for the phase in the curriculum. Right. So, or if it's a summative one, does it measure what you've built on paper as the content that's within the curriculum? And Carlos Calleras at Maastricht, who's a physician and a medical researcher, a PhD, MD, and one of these guys that knows more about these things than a lot of people do combined. His simple message during this day-long seminar was to do what you can to increase the signal, decrease the noise. So, you know, med schools have they have a battery of professionals, psychometricians, learning science analysts, educators, medical educators, and of course all the clinicians that are clinician educators as well. You know, in America in athletic training, we don't have that, right? We're a lot more thinly supported, both from a skill set standpoint and a personnel standpoint, and resources, a matter of time and IT and technology and those types of things to do these things. So you have a choice. You can either find people to help you do all the high-level psychometrician research and data analysis. You can do it yourself, or you can follow best practice in order to increase. What kind of things can you do to increase the signal, to measure what you really want to measure, and decrease the noise and minimize the distractions and the things that don't really measure what you want to measure. So that's really one of the main threads to today's presentation is best practices to increase the signal and decrease the noise. The other one that's important is construct validity. Does the test question measure an underlying cognitive trait? So this comes into play with the idea, if you look at my backdrop story about my hesitancy to use MCQs to measure thinking process. And I think a lot of people may perceive that MCQs aren't real good at measuring thinking. But if you really want to measure an underlying trait like decision-making or reasoning, and you want to say that this test or this assessment of this collection of questions on this test is a great way to measure clinical reasoning ability, whether it's diagnostic reasoning or therapeutic reasoning, or clinical decision making from an AT student that's on the field, you know, dealing with an acute injury, a compound fracture, a dislocation fracture, internal organ damage, those types of things, right? Where the stress is really high, the context is very different. So construct validity comes into play and is more of an issue to focus on if you're changing what you want to measure on a higher level. So maybe you've been here as a student before. I think probably everybody could think about a class who've had summer in education where, you know, we read this stuff in the book. It's because from a nursing meme, actually, I thought it was quite funny. You know, and then the lectures is a contrast between what we read in the book and what's in the lectures. And again, that's more and more prominent today, I think, with evidence-based practice. If you're working hard to update your evidence and incorporate that into your teaching. Clearly, the evidence is, even though it is slow and somewhat glacial in some areas it's not. It's coming out fairly rapid. But I think it's fair to say that in a large ways, in some manners, evidence is produced faster than textbooks are. So, your clinical experience, does your clinical experience not match up with your textbooks? So if you look at clinical experts and that teach, there's often a disconnect between what they teach and what's in the book. So there's a difference there. The second difference is a little more significant, right? Is what we cover in our classes. That's the content, right? So that's that content validity with what we put on a test, right? So kind of a funny scenario there. A patient has a closed tumor fracture, and we go to these kind of questions, which makes you scratch your head. So obviously, in most contexts, discrimination is a bad word, in a very negative context, for a lot of reasons, and rightly so. And the psychometric item analysis world is actually a very important term. So discrimination factor or discriminatory power when it comes to item writing is extremely important, right? And you think about it, what we really want to do is distinguish our really good students from our good test takers. And to me, this challenge of explaining, articulating, or providing evidence for our really good students with our good test takers becomes difficult when you get a reference check on a student. How is the student in the clinic or the classroom? As a program director, I don't practice clinically anymore. I'm like, well, I can't respond to how they practice clinically. You'd have to talk to a clinical to supervise him or her. I can tell you, they have a 3.7 GPA. Oh, that sounds good, right? We know there's issues with GPAs, and grade inflation and those things. But what really is a 3.7 or 3.2 GPA measuring, right? So how confident do we have in that grade point average across our curriculum, not just in the classes that I teach, but across my AT program and the classes that my AT faculty teach with us and for us? What does that 3.7 represent? Is it that they were a really good test taker, right? And maybe in a clinic, they struggle? Right? And that would come out with multiple assessments, of course. So discrimination on a particular exam allows you to determine or distinguish the high performers from the lucky ones, from the gamblers, from the good guessers. So if best performing students get a question X incorrect, the question X is probably poorly written or conceived. If poor performing students get question Y correct more often than the high performers, then it's another element, right? So looking at those psychometric reports, the data that comes with your Scantrons, if you use that type of device, is really, really important to look at questions that might need to be thrown out or might need to be thrown out now, but you like the heart of the question, and then you want to save it for another. You want to use it again for either for a final exam or for next semester or next time or something, whatever your purpose is with your programmatic assessment. Discrimination factor data is really important to help you figure out some of your questions that you need to keep, you need to tweak, or you need to throw out. So we'll come back to that when we do our Psychometric 101. So content validity and discrimination are two important variables, and there are others, but we're going to come back to that a little bit later. I'll have you be so kind to launch the second batch, 3 questions of our quick strike.
Okay, it should be with everyone.
All right, so again, 3 quick questions. I may have already biased the results on this a little bit unintentionally, but based on what you thought coming into today, kind of use that preface for especially for question number 1. You may have picked up a little bit of a hint from me. So if you're done, you're looking at that little comic strip, right? That's a very common mistake. And I've made the mistake several times myself where you actually put the answer to a question in another question. Students are good at figuring it out. So 5, 4, 3, 2, 1. Final votes in, please. Great. What do we have here? We can assess. True, 87%. Good. Optimal number of questions. Yeah, okay. Question number 2 is the most exciting data point we've collected so far. So only 5% of people think that 3 basically majority figure 4 or 5 is the optimal. And again, there's some challenges with the word optimal, but for the purposes, I know how to discern. So about 63% don't know how to discern. Okay, good. Those are good supportive numbers. So we're on the right track here. Okay. So moving in. So again, when you design an exam, right, there's a lot that goes into this that we're not going to cover, but just so we make sure we're on the same page, right? What goes into your exam is the timing of it, the purpose of it, is it formative, is it summative? It goes into what you teach, how you teach, what you value in your program, what you value in your class, whether it's a programmatic assessment or a class assessment, right? Those are all the contextual things that go into programmatic assessment, and they are individualized. They go into your level of expertise with the content material goes into it, obviously, and other factors as well. If you're not familiar with this Miller's pyramid, it came out back in '90. It's been updated a few times. It's widely used as a core aspect of a lot of medical education, and it is the core of what we use in our AT program here at Ithaca College, kind of expanding the idea of competence, skills, and performance. And again, if you saw my last webinar, I use capabilities, and I won't go into that now. But you see here that for the most part, it's a pyramid that builds on each other, and obviously it's somewhat of a fluid thing. All levels contain the KSAs, and everybody's familiar with those, and we progress from novice to expert. Although I think the challenge with this is, expert. It shows that expert maybe happens too fast and too readily, but that's a different conversation as well. But you see here down at the bottom, our MCQs are pretty much, standard, and true falses too, standard fodder for the nose, the lowest level of cognition, right? So what do students know? And so people have historically used MCQs for a demonstration of what a student knows or the opposite doesn't know. And, Alfred North Whitehead has a famous quote that, the merely well-informed man is the most useless bore in God's earth. Translation, what's the point of someone who knows a lot? It's more important to know what to do with it. So again, it kind of goes back to that model I gave earlier about a student with 3.7 GPA, but has, moderate to okay evaluations in the clinic versus a student that has maybe a 3.2 GPA. B average-ish, and is a rock star in a clinic, right? So, but we do know if you're following along or looking ahead, right? MCQs are also included in the knows how, and then you'll see that phrase again: extended matching type questions. So EMQs for extended matching questions, and MCQs can also be used for the second level of Miller's pyramid through the presentation of cases or scenarios. Or narratives where students are charged to pull out relevant information, key features of a case pattern presentation, those types of things. So you certainly can do that. We'll get more into that in a little bit. And it was Miller that actually came along in the same paper in '90 and said that, and obviously it's a lot more meaningful for a student to be able to know what to do with information. And Pat McKeon, one of our faculty members, is famous for a line that we have in our program is, information doesn't turn into knowledge without experience and without connection, right? It's the process of turning information into knowledge that is learning, and that's important. And knowledge being represented by the integration and synthesis and the ability to deconstruct and apply and those types of things. So the point here for now as we move forward is that we do know that MCQs and extended match questions can be used to move up the pyramid a little bit into the knows how. And you can extend the knows how into knows what and when as well, right? A little more of the what, a little more of the when, and a little more of the why. So if the pyramid were bigger, we could add those other words in there. So if this is new to you, add the what, when, and why to the knows how part to expand the idea a little bit. So the anatomy of a multiple choice item or question. The question is the stem, right? And then the response options listed over here in the bottom ABC can be multiple and can be varied. And then if we break down the options category a little further, you have the key or the correct answer, and you have the distractors. Okay, so again, the stem is the question or the lead-in or the setup, the problem to solve, the issue to be answered. The options are kind of self-explanatory. And then distractors, in this case, you have two distractors and one key. You recall one of the questions a few minutes ago is what's the optimal number? And we had most people dialing on number 4 or 5 was the response. And again, just to remind you, if we're talking about this Miller's pyramid, this question clearly is at the bottom of the period. It's a basic factual recall. Obviously, this is something that I teach in my class, so it's a question I teach in my class, and I hold it to be important and for certain reasons of clinical assessment and of course of rehabilitation, bleeding the two together. But in this particular context, this question, if I were to ask this, I'm simply assessing something at the nose level, at the bottom level. And you can see that there actually is a rhyme and reason to the types of answers here. Right? And obviously you see this is, there's a certain number of responses, which we'll kind of make more sense of in a minute. Okay, we've all kind of seen that scenario in our life, right? Especially maybe on SATs or GREs or entrance exams to college or university. I don't know if you have those in Europe and other parts of the world, but we do here in America. But maybe you had that experience that Hagrid's had somewhere in your career, which stresses you out in the middle of an exam. All right, so the STEM, or the question, there's an art to it and there's a science to it. So here's some kind of take-home 101, right? As far as writing clear stems. Number one, the stem should be meaningful alone, all by itself. And when I present the last tip for writing clear stems, it connects back to this one, number one. So number one should be meaningful alone by itself, which means you should be able to look at the question, right? And you should be able, you yourself should be able to know the answer without seeing any options. Right? And to kind of spill the beans a little bit, I guess to go with our biological metaphor here, it should pass the eye test or the cover test. So one way to see if you've written a good question, right, a good stem, is to cover up the answers, or before you start the options, or before you look at or write the options, you look at the stem itself. And can you answer that clearly and cleanly? A better way to do that, because we all have biases and we all have context, fatigue, and those types of things, and things in our mind, right, are that you can have a colleague look at it. And there's significant evidence for having other experts review your questions and your STEM items before you go to print. Number two is that, and this is kind of a black and white, kind of a grayish fluid spectrum one, really, to be honest with you. But the advice is that the STEM should not contain irrelevant material as a general rule, right? And if you look at a lot of questions we write, they sound great, maybe a little wordy, but you go back and look at them a year later or a few months later after you've given the exam, you realize there's a lot of material in there that is not really relevant. And generally, quite simply, irrelevant material clouds the cognitive processing, overloads the cognitive processing of the student on other areas. And you're trying to actually measure what you want to measure, a clear STEM. Now, if you're actually trying to assess relevant from irrelevant, like in a case scenario, there's a caveat, right? So if you present a case scenario and you want to put in some factors of the case, like the time of the day and the temperature of an athletic event, and they are irrelevant to solving the problem, that's different. So depending on the level of learning that you're approaching, there is a caveat for suggestion number two. Stemless items, the plant without the stem, is the most common flaw seen in psychometric analysis. And a stemless item is, simply put, doesn't have a clear problem to solve, no question to answer. And basically, a stemless item results for a failure of 1 and 2. All right, so if it's not meaningful by itself, it doesn't pass the eye test or the cover test, right? You can't look at the stem itself and answer the question, you know, like on Jeopardy, right? You see, well, Jeopardy gives you, it's weird, it's not really a question or whatever, but on a quiz show, right, you see the question and it's not a multiple choice. So you imagine it as a single best answer, fill in the blank question, right? A stemless item has no clear problem to solve, no question to answer. It sounds simple and obvious, but be amazed if you go back and look at some people, like if you got together with your colleagues, said, hey, everybody, for lunch on Friday, and we actually have done this in our program to help kind of connect the dots. Hey, everybody, bring an exam, bring a page of one of your multiple choice exams, and then you have dinner, have lunch, whatever, and then you pass them around and have people read your questions, right? And then you're going to find out, a lot of people go, what are you asking here, number 4? I think I know what you're asking, but I don't know I'm not sure what you're asking. If you get that response, I don't know what you're asking, I'm not sure I know what you're asking, right? It's a stemless item, right? There's not a clear problem to solve. And that happens more often than you would think. And I found it in numerous of my exams. And that's part of the art, and kind of like writing a poem or writing a book chapter, of rewriting and rewriting to make it really clear and avoid the stemless flaw. So there's your stemless item. I just cut off the stem. I know, pretty artsy. Writing clear stems. Avoid negative stems. Another really common problem, and I see this a lot. And if you use textbooks and you secure or use all the fancy stuff that comes along now. One of the reasons why textbooks as a sidebar, textbooks are so expensive, I think, is because they all feel obligated to produce resources, right? PowerPoint slides and exams and test banks and problems and case studies and those kind of things. And I'm not saying they're all bad. And there's one particular book I use that I like, but one of the books I've used, I want to identify it, has questions at the end of every chapter, and they get a digital package and you can use them. They do this all the time. And chapter by chapter, they use negative stems. So if your questions have except, not true, least likely, something to that effect, it's called a negative stem. Right? So the reason why negative stems aren't good is because they allow the student to rationalize the distractors. Right? And what's funny is, and the data supports this, the better students actually rationalize more. They go, well, if this were happening and that were happening, or in this context, that would be true. Right, so they start to then make more correct answers out of the distractors, and then they come to you and question you about why they got it wrong, and you read it, and sometimes they'll go, "You actually said in class that sometimes this can happen, or if this and this were happening." Right, that's the context of clinical reasoning. So negative stems, to me, is a direct conflict with contextual reasoning. Right, with the clinical reasoning, where experts use the context to really situate how they're thinking. Right, therefore, it reduces the discrimination factor. You start to lose your discrimination power within your exam between good students, the really good performers, and the good test takers. The other thing it does is a lot of times it focuses on recall. So you may be designing a question that's intended to do cognitive processing or clinical decision making, but if you use negative stems, it forces a student to reduce it to a recall nature. And the problem with that is they may know the one wrong answer, the exception, the but, the not, right? But it doesn't mean they understand. This is really important. It doesn't mean they understand why the other choices are correct, right? So it's kind of flipping it around. The reason why you're asking that question, assumedly, is that you want to see if they know something about the three options that are correct, right? So in this case, you've got three correct options and one incorrect because you've asked all the following except. Well, they may know that one factor. Now, that may be important, right? In certain situations, like drug contraindications or emergent care procedures, like the one thing they're not supposed to do is move the head in a suspected spine stabilization thing, right? So again, like other things, most things in life, it's not an all or none. So I'm not saying don't ever do it, but avoid negative stems in general. But if you're using a negative stem, use it on purpose. And these are two good examples if you're doing a pharmacology class, drug contraindication, things that have dire outcomes, and missing key vital signs of, if someone has internal hemorrhaging, not checking blood pressure or something to that effect. Number 5, the stem should be a question or partial sentence. And that's kind of obvious. You're kind of saying, duh, Paul, that makes sense. But make sure that it allows the student to focus on answering a question, not holding a partial sentence and working memory and sequentially completing the phrase with each possible answer. What I mean by that is if it's not a clear question or partial sentence, and they have to kind of factor in, they have to reread in their head the sentence and factor in each one of the questions in a syntactically complicated way or awkward way, that's using a lot of cognitive juice, right? So from a cognitive overload theory, they're using a lot of cognitive load to grammatically put in the different options, especially if there are 5 of them or more, right, into the possible scenario you've created. All right, so what you want to do is avoid the cognitive load on the student that's not related to the question that you actually want to ask. Right? And so the most common way this is done, and I've done it for years, is have fill in the blanks. The blank best way to ensure that your core temperature doesn't rise is blank, right? And that's even worse because there's 2 blanks, right? So that's another thing you don't want to do is have double answers because you're asking for 2 things, right? So the most common way that you see stems being improperly written, confusing and placing cognitive load is you have a fill in the blank somewhere in the middle of the sentence. They have to read that sentence in their head, right? Sometimes you hear them doing it out loud with each possible answer in there, right? So it should form it more as a true sentence or partial sentence so it wouldn't avoid the fill in the blanks. And then lastly, and I put it here on purpose, it relates all the way back to number one, is when you're done writing that question, can it pass the cover test or what some call the eye test? Give it to a colleague, right? And the evidence suggests that your validity of your test can improve by between 17 and 20% if you have expert assessment. And again, we're all busy, we don't have time, but I have 5 or 6 great faculty members, and I'll hit them up each differently. And my person who teaches Gen Med stuff, and if I have 10 or 12 Gen Med questions on a progress exam, I'll deliver them to Courtney and say, hey, go through these for me. And she's our content expert on Gen Med. And if she comes in and goes number 2 and number 7, I don't know how to answer it. Well, if a person who teaches it doesn't know how to answer it, it means it's a poorly written question, then I probably need to change it. So use the eye test or the cover test. Okay, so that's for the STEM. All right, so as a review, avoid negative stems, right? Avoid stemless items. The number one error actually for when you do scantrons is answer key errors. So be careful when you fill in those bubble scantrons and run them through the computer, because your data is going to be off if you screw up just one of them, especially one early on, and then your sequence is off. So that's obviously the number one error for bad test results, but that's aside from writing. Outdated information kind of goes back to the content, right? What you teach, what's in the book, that funny meme from nursing education, but what's in the book, what's in class, and what's on the test, is making sure that you're testing what you're teaching. And blueprinting errors. Blueprinting is another skill to learn, and I did this presentation a couple times, and it's a different presentation. There's a great book on, article in academic medicine on 12 tips on blueprinting. How to actually blueprint an exam. If you're doing a summative exam, you really ought to learn and incorporate some fundamental tenets of blueprinting, which is how you map out how many questions from each domain, like how many questions from orthopedics, how many questions from emergency medicine, how many questions from psychosocial, and you actually put a rhyme and a reason to that, and then you build your test based on the blueprint of it. You also include how many hard questions, how many really hard questions, how many easy questions, how many moderate questions, etc. And that's how board-based exams are made. And if you're going to do summative assessment, I encourage you to do that as well. And of course, technical writing flaws, right? So yes, grammar matters, spelling matters, syntax matters, and of course, be careful of not putting clues in your questions, especially answers to other questions that are close by in the exam flow. All right, so I want to be clear with our choices and make sure there's one correct answer. So leading into, coming away from item writing, STEM considerations, leading into now, the writing tips to increase your validity and your discrimination. So avoid adverbs, right? As soon as you put frequently, typically, usually, almost always in your question, you're opening up the opportunity for more than one correct answer, because it's not an absolute. So a good tip is to increase your validity and your discrimination in your stems are to avoid adverbs, be more direct. Second tip is to avoid absolutes. Do not use never or always. Again, there are times when you would, right? You never want to do certain things in emergency care. You never want to, passively move someone's knee when there's an obvious bony deformity, right? So again, use these in context of what you're asking and what domain you're assessing. But avoid those as much as you can. Use them on purpose when there is an absolute clinical relevance to them. Avoid overlapping questions where part of one question is contained in another. Right? We do that more often than not. So you can look at one question and realize you get to number 15 and go, oh, yeah, the same question is part in here. Students will map that out in their head and they'll go back and they'll use them and feed off each other. Again, the test takers will figure these things out and use these strategies, which will disrupt your discrimination factor. Avoid overly complicated verbiage. I tend to do that. So it's one of the mistakes I have to do. And a lot of times my second, third rewrites, I go back and try to simplify things. And then avoid repeated elements within questions. Right? So when you have repeated elements within a question, that allows a convergence strategy. Students can actually converge part of an element that's in question 10 with part of an element that's in question 2. Right? And you also want to avoid overlapping responses. And that happens a lot with dates and numbers. And I'll get to that more when we talk about items in a second. So there's a lot of commonality and overlaps. Make your stems distinct, right, and distinctly different. And you can see that those of you who are familiar with extended match questions, there's actually an opportunity to avoid doing this because you can generate a lot more questions off of one scenario. And I'll share that with you towards the end of the talk if we have time. So now when it comes to writing distractors and keys, so the options that follow, number one tip is of all options should be homogeneous with the stem. Right? So they should be written in the same language, in the same syntax. Grammatically, they should fit in the sentence. So it takes a little time and effort to make sure they all start with a or an. If the sentence sets you up for that, if the stem sets you up for that, so you have to pay attention to that. Oftentimes we forget an a or an and in one of our options, and the students identify that and use that as a strategy. So they should be the same style and the same length whenever possible. Generally, the rule is longer stems and shorter responses usually work better. If you flip that around and have a short stem and really long options, that creates a lot of cognitive overload and a lot of issues with validity and discrimination. So try to keep the style and length of your stems and your items and your responses about the same. Use the same language and verbiage. Use consistent grammar and punctuation. And lastly, this is the hard part. Does the stem in each item or response, make a complete sentence? So you got a great question, a great stem, you love it, it's asking what you want, you've double checked it, you've not used adverbs, you've not used negative stems, and then you've got 2 good or 3 good item responses, and then for whatever reason you want to have a fourth, and you struggle to put a fourth one in there, and maybe you're struggling to put a 5 in there because you believe 4 or 5 works better because it reduces risk of guessing. You'll find that 1 or 2 of your responses don't make a complete sentence. And that is where the art comes in. So it forces you to change the articulation of the stem, right? And then maybe then forces you to change what you've already written for the other items. So that's the writing a paragraph in a paper, right? And making sure that you're not using passive voice and those types of things. So there's the language aspect that is really, really important with writing good items. Here's another really important one. This is probably the one that I corrected the most. So once I taught my colleagues how to do this, and I try to encourage them to do this better because we're building our own test bank, right? We're not just using these for classes. What we're trying to do in our program is develop a test bank to use for, if you came to the first webinar, to use for our progress testing, part of our formative assessment. So I want to be able to have a test bank of good questions that have high validity and high discrimination factor, and be able to pull those out and use those as progress tests. So I'm teaching my faculty how to do this. And I say, look, when you write a test for a midterm or a final or whatever purpose, let me look at it. I'll take the time to look at it. And so the most common thing I found when they brought them to me was that things weren't parallel. So for example, the STEM would talk about a certain deficiency or an injury or a diagnosis. And within the answers, within the responses, there were 2 anatomy answers and 2 physiology, right? So right away, the student reduces that to a 50-50 chance. Right? They'll either say, well, it's either an anatomy one, so it's A or B, or the answer is a physiology one, it's a C or D. Right? Or maybe you ask a question about a disease, and 2 of your answers are infectious disease, and one's a congenital disease condition. They're going to eliminate the congenital one, and they're going to boil that down to a 50-50 on the 2 infectious ones, just on the odds. They figure our brains, the way they work when we make tests, are biased, right? We have bias too in how we do this. So students pick up these types of test writing biases. So make sure that your responses, your options, your key, and your distractors are parallel. And I mentioned this a second ago. Avoid overlapping answers. The book I referenced earlier does this all the time, right? So if you have 2 to 8 days and 4 to 8 days and 8 to 10 days and 10 to 12 days as your answers, that's an impossible thing to answer because you have multiple overlaps in numbers. So if you're using numbers for, vital signs or norms, right? Blood range, hematocrits, if you're using it for temperature and relative humidity, right? So if you're asking factual recall, low-level model knowing questions, avoid overlapping. So that takes some work sometimes. You don't realize that you overlap, right? So with numbers and timeframes, don't let your answers overlap because then right away more than one is partially correct. All should be plausible options, right? So remember the meme I had earlier that had Gary Busey and chicken or something like that? Right? Clearly those are non-plausible options. So you've eliminated those 2 and made it a 50-50 choice by only having 2 plausible, right? So only make plausible options. And this is where it gets hard. I'm not going to lie. It's not an easy thing to suggest. If you believe with 3 or 4 or 5 or 6 options, right? If you're going to go with a 4, 5, or 6 option MCQ, all 4 or 5 of those options have to be plausible. And so again, that's what I was doing when I talk about my backdrop. I believe that 4 or 5 options are better because it decreases the odds of chance, of guess. And so I tried to write MCQs early in my career with 4 or 5 options. I hardly ever did 3, thinking it's a numbers game. But it gets really hard in a lot of situations to write 4 or 5 plausible options. And then whenever you can, put them in a logical order, right? So, you know, if it's an inflammation question, you know, inflammatory and repair and fibroblastic, right? If you're asking a question germane to one of those 3 phases of tissue healing, you know, put them in that order, right? So that's again, I haven't really found too many explicit examples of the need to do that, but that's what all the literature suggests, is that whenever possible, if there is a logical order, put it in a logical order. And here's the other big one. Do not use all the above, none of the above, and aggregated answers, meaning A and B, C and D, A and E, or all but D, those kind of things. Throw those out completely. They detract majorly from your exam item validity and your discrimination, because students can eliminate 1 pretty easily, or they can include 2 pretty easily, and then they end up picking one of the all the above and none of the above, depending on what they have. So it's a gift on a silver platter to test takers, and it's a challenge or a decrement to your more skilled students. So avoid those. And of course, when you're done and you look at your questions, verify that all distractors, right, the non-correct answers, are undoubtedly wrong. So I used an adverb, even though I told you not to use adverbs in your stems, but here it fits. You have to assure yourself that your distractors are undoubtedly wrong. And again, that's easier said than done. It looks good. You've gone through it all in your head. It's undoubtedly wrong. But then you're going to start to scan your exam results and notice that there are many that can be explained, that can be contextualized and proven wrong. And then that's how you change the question. You change the responses and then edit it and save it for next time. Okay, so how many options used for the MCQ items? We had various ones. Most people chose 4 or 5. You see here this great study, a meta-analysis of 80 years of research conducted way back in 2005 in an educational measure journal. And you can see that based on the evidence synthesized in this extensive, huge meta-analysis, the IDA writing rules can be revised. 3 options are optimal for MC items in most settings. Right, so maybe that's a surprise. So we only had a third or less than a third of you say 3 is fine. Most people went with the 4 or 5 option, which again is the standard practice. And some of that is we were taught that perhaps, but I think most of that is because that's the way we experienced it as students. Most of our exams had 4 or 5 multiple choice options. I can say for me, certainly, that's where I got the idea from. So according to this extensive meta-analysis, 3 options are not only fine, in this opinion, they're optimal. A study directly from medical education, reducing the number of multiple choice options, response time, psychometrics, and standards. This is a really interesting approach. What they found is that only having 3 options saves students time on the test. You think, okay, well, that means they get up and walk out earlier. No, it means that you can actually include up to 16% more information, questions, right? So again, you need to have about 100 MCQs. If you do an summative exam, you need a minimum of 100 questions to have any validity. If you're given a summative exam for your students, then they have to pass it to graduate or sift through your boards, and it's 75, 80, or 90 questions, you've got significant validity issues to investigate, which means students can challenge that if it's really measuring their ability and what they've learned. So you need a minimum of 100, and most sources suggest up to 150. Right. So again, generally, the more questions you have, good questions, the more your test validity goes up. So what this study found is that you can actually, students can actually answer questions 5 seconds faster. Right? And so you can include 16% more questions, which will possibly increase the overall validity of your exam. Right. So if you have a 50-minute class like we do on Mondays and Fridays, I'm giving a midterm or an important summative exam that's in a 50-minute time slot, if I can answer, if I can ask 16% more questions, right, then I can assess more of the content, more of the semester, more of this aspect of the curriculum. So again, according to this study in MedEd, again, George Bordage being one of the godfathers of field medical education, being the senior author on this paper that came out in 2014, 3 options are a great way to go. And then kind of continuing on with this same study, in the concluding statements and suggestions for future research, they refer to this paper, a meta-analysis, the one we just saw, of 80 years of research supporting the use of 3 options. All right, so 80 years of research shows that 3 MCQ options are a great way to go. They do not threaten validity and may even increase it because you're allowed to ask more questions to get over that or closer to that 100 mark. So the moral of the story is to spend more time eliminating those poor distractors, the Gary Buseys and the chickens and whatever else was on that one, and less time try to force the bad distractors into the mix so that you have 4 or 5 option questions, which is what I did for years, banging my head against the wall. Another study showed the same effect, that the 3 option MCQs are psychometrically equivalent and sometimes superior to 5 option items. This study was actually done in personnel testing and actually outside of medical education. And it actually includes a number of practical, economic, and administrative advantages to 3 option MCQs. Yet, amazingly, the 3 MCQs are underutilized. Most people still go with 4 or 5. Interestingly, in this test, they also found that perceptions of the test, fairness, and those types of issues, criterion-related validity, which means they compared them to other criterion and content of what they were assessing, and then in both race and sex responses between a 5 MCQ and a 3 MCQ exam, there were no differences. So this one went a little further and beyond some aspects to bring in aspects of identity with gender and race, if you're wondering about the application of that on different populations. Again, 3 options is a great way to go. So translation from those papers and many others, there are 4 or 5 others I could have put in there. 3 option MCQs are just as valid, if not more so, than 4 or 5 options. They save you time making a test. You only have to think of 3 options. They increase content coverage by up to 16%, allowing you to put more questions in a given test. They increase test validity and discrimination because you don't have a bunch of bad distractors. Right? So again, the summation is 3 options. Now, don't mishear me and don't think that I'm saying there is no reason or need or application of 4 or 5. There certainly are. Depending upon what you're asking, it's viable and recommended and useful to have 4 or 5, especially when certain aspects of anatomy, right? Specific muscles. Maybe you're asking a question about, all the muscles in the anterior compartment of the lower leg. There's clearly more than 3 muscles. So listing all of the muscles there as a 4 or 5 option would clearly be a valid way to assess that person's knowledge about a specific muscle in that compartment. So in our context of AT education, yes, there are 4 or 5. The take-home point is you don't have to stay up till 3 in the morning getting valid 4th and 5th options for your 100-question multiple choice exam. And if you do so, you're probably going to actually defeat your purpose. You're going to decrease your validity and discrimination factor. So this question kind of summates it, right? You probably have questions like this. You're like, oh my God, which one is the right answer? Which is really teal. But I developed this little mnemonic. So the big picture for using 3 option MCQs is they must be plausible. Make sure if you're going to go with 3, that all 3 options, so one key and 2 distractors, they're plausible. Make sure that they're homogeneous, kind of bringing all of our rules together. Make sure there's only one absolutely correct option, right? And make sure that they're parallel, right? That they're part of the same system. If you're doing a pharmacology question, make sure that all the drugs are anticholinergics, or make sure that they're all antiarrhythmic, right? As soon as you throw in a cardiac drug that's not antiarrhythmic, it's not parallel, right? So you minimize it. So those are the mistakes that lead to better guessing. Okay, so your guessing concern can be acquiesced if you follow the basic rules and best practices for writing items and responses. And if you do so, you will have greater validity. You'll have greater distribution, meaning covering more of the curriculum or more of the class, because you're going to ask up 16% more questions. You'll have greater discrimination between good performers, real performers, and good test takers or gamblers, right? And you'll save yourself some time trying to generate non-plausible distractors in order to get to that 4 or 5. And again, as I said, it's fine to use 4 or 5. There's certainly a lot of context where 4 and 5 is very, very worthwhile and very meaningful way to go. Okay, so in the chat box, if you will, I'd like to put you to the test here. So this is from one of the textbooks I mentioned. It's an actual question. Tell me what you think is good or bad. If it's good, you don't need to say anything. If you identify something that's bad, unadvisable, what do you think it is? So we have a few of these. I'm not going to spend too much time, but what do you think the problem with this is? Right? Right? So if you had something to this effect, right? Overlapping answers, right? Need 4 to get 1 correct. Cognitive overload, time sucker, right? So this question will take a student way more than the average, right? 5 or 6 seconds to solve. This is a real cognitive overload question. They have to factor in each of the 4 options within each of the 4 options, right? The 3 distractors and the 1 correct answer. So the book that I'm referring to, I won't mention it, has a lot of these, has 2 or 3 of these types of questions in every chapter. And you know, does it pass the eye test? Can you answer that question right away? Right? It takes a lot. Can you get there eventually? Yeah. Here's our next one. What about this one? A little easier. Which of the following symptoms would be effectively treated by antihistamine? So number 1, there's an adverb in the question, right? So student might dial in on effectively, right? What does effectively mean? Get rid of it or reduce it, right? But what do you think? I'll give you a few seconds. Just type in what your thoughts are. All right. So hopefully you realize there's more than 1 correct answer, right? So you have heterogeneous options, right? So number one is more than 1 correct answer, right? Number 2, the responses, the options are heterogeneous, right? Nasal congestion is longer than cough, right? And again, it may seem trivial, but it's important, right? Students start to realize that generally, statistically, they intuitively know that longer answers are usually more correct. Right. So, you know, can you argue that all 4 of these would be correct? Right. Now, if so, then you put all the above. But we've already told you that that's not necessarily the way to go. The other thing is the question has symptoms in it. Are these all symptoms? Are there some signs in there? Right. So if they're not all symptoms, then again, they're not parallel. So again, this is a question you would, right? Maybe not this exact question, but I've probably written things like this a lot. And I know I have, not probably. And you kind of jot this down and you don't take the time to realize that you have a combination of signs and symptoms. So automatically you got a problem. We have 1 more, maybe 2 more. And 1 more. After significant infection, strength may take blank to fully recover, right? Simple enough looking question. Well, we got an underline in there, we got a blank. So we told you not to use blanks because the students have to mentally plug in each one of these answers in the sentence and maybe run it through their head a couple times, right? So the first cue is that we have a blank filled in here, right? So it's really a negative stem example, all right? And it's not homogeneous, right? So D is not the same as A, B, and C. So students are going to eliminate D here if they don't know the answer. So guessers are going to eliminate D, right? And they're going to figure out that it's one of these 3. So now they got a 33% chance of guessing, right? Furthermore, you have some overlap. There are 2 to 4 days within 2 to 4 months, aren't there? There are 2 to 4 weeks within 2 to 4 months, right? So you've got major overlapping responses here. I don't even know how I would answer this question. There's really, or tell a student who argues that they got it right that they don't have it right. And one last one. This is an easy one. Which of the following is not, in capital letters, suggested a potential hypertrophic cardiac myopathy? Well, it's a negative stem, right? So you have not in there. Right? Okay. So if you pass some of those, good on you. You got a good head start. All right. So how are we doing here? Let's see. Okay. Psychometrics 101. So Mark Twain is famous for saying there are 3 kinds of lies: lies, damn lines, and statistics. All right. So the old, stuck on a test question, right? Haven't picked B in a while. Most students know that B is often the most correct answer. Actually, I haven't seen any data on that, right? On varying responses and which one the key is correct. But that's another little tip, is to make sure you go through and you'll notice that we tend to use B and C a lot. And if you don't go back and look at that, you might realize that you use B and C a lot, and students figure that out too. I haven't seen any data on that, but I'm sure somebody studied it. All right, so I know there's a lot here. So again, you'll have access to this, and I took a screenshot of this, and I'll share it at the end and give it to you. So don't worry about trying to write all this down, but take your camera out or do a computer screenshot. So when you do the scantrons and you get all that data, this is the scary part I mentioned earlier. The PBI, the point by serial index, is one of the most important pieces of data, and it's really not that complicated, that you look at for each question, right? And each option, not just the ones that are correct. You want to look at for all the options. So it's a correlation between score on an item, so question 10, versus score in the exam. So you look at student Susie, right? She got a 90 in the exam, and she got question 10 wrong, right? So if she got a 90 in the exam, and that's the highest score in the exam, obviously she's a high performer. She did well in the exam, but she got question 10 wrong, right? And perhaps the student that got a 45 in the exam, you know, much poorer, much less worse outcome, got that question right, then there's a problem, right? It means that it's a poorly worded question, poorly designed item. There's more than one correct answer, right? Some of the violations have occurred that we mentioned already. And that perhaps the student that did poorly guessed on it and got it right, right? And that the student who did really well and got it wrong is an indication that it's a bad question. So here's the numbers that you get. So positive BCI is good. Anything that's negative, look at the bottom there. Any negative number you get for a biserial index, it's a big problem. You have to throw that question out. So I don't ever do, what do you call it, scaling. I don't scale my exams. I never have. I do correct them and give points back, and maybe that's a way of scaling. But I'm honest with my mistakes, and I throw out things that I made mistakes on. But when I started to learn this stuff with my Scantron data, then I started to, and again, in an instant of, or in respect of building a test bank for future progress testing, I really started to use these numbers importantly, more critically. So a positive BBI is those who score well in the exam. Anything less than, that should be 0.2, excuse me, not 2.0. Anything less than 0.2 is a poor item. You need to revise it, right? Anything that's 0.2 to 2.9 is fair. 3 range is good. Anything above 4 is very good, right? So anything less than 0.1, I would look at the key. Maybe you circled the wrong key, the wrong bubble. Anything that's less than 0.05, and you'll see variances in these numbers and recommendations, needs to be discarded. Anything that's negative clearly needs to be discarded, right? And I've had some negative ones. Now, keep in mind that if everybody gets the question right, if it's a really easy question, and sometimes that's important, right? You want to know, right? What's normal blood pressure? What's normal heart rate at rest, right? Those are absolute questions. And if it's a freshman or a sophomore or an early clinical level, right? There are things that we want our students to know. That goes back to your values and your program and your curriculum. So not all questions that have a 100% yes correct number, right, are meaningless, right? It depends on what you value in your exam, right? The item difficulty that comes out on those stats is also called a p-value, not to confuse you, is simply the correctness, the percentage of correct responses. And generally you want between 30 and 80%, right? If it's more than 80, it's too easy. If it's less than 30, it's probably too hard, right? But again, you want a certain breakdown that comes out with blueprinting. The KR formula, KR 20, is an indication of your overall test, right? Anything over 0.5 is pretty good. I mean, if you give the same test to a similar group of students, if I took a test that I made and marched over to Cortland State University, which is an hour away, less than an hour away, has an AT program and gave the same exam, right? The higher the KR 20 number is, means that I have a good reliability aspect with that exam. So when you make a teacher-based exam, 0.5 is good. That's not good for like a BOC exam. Right? Anything over 6.5 is very, very good. Anything less than 5, you have to think about, is this really a good exam? Maybe I thought I'm testing more what I wanted to. And then here's the blueprinting part real quick. You should have about 5% of your questions is very hard, 5% very easy, 20% difficult, 20% easy, and then 50% in the middle. And you can look at the item difficulty, the p-values, to determine how many questions fall in this breakdown. And then that's how you figure out if the test you gave was too easy or too hard. Make sure you look at PBIs for all of them, not just the ones that were correct, right? And then if you have too many very hard and too many very easy questions, your reliability is going to go down because they end up with a lot of guessing on the hard ones, and you end up with a lot of poor students, poor performers, doing well on the very easy ones. Okay, so as far as assessing measure critical thinking, it's very clear that properly constructed MCQs, again, a lot of you actually said you could, which is very good, and I gave some hints and giveaways that you can do MCQs and assess interpretation synthesis, higher order thinking, instead of just isolated recall, and there's significant evidence to support that. There's more than that, just three of the ones that I've used. So remember this question earlier? So it's reworded a little bit. So the stem is reworded just a little differently, right? And what I'm trying to do here is show you the same question, which on the early part of the presentation was a nose question, right? Simply, it was a recall of which muscle does what from a functional standpoint and memorization. I just reworded the question into a clinical problem, right? A patient with ACL reconstruction who's had some immobilization, maybe some NMI due to immobilization or some issues with their rehab, is having issues gaining that last 10 degrees of active knee extension. Right? And that genius reticularis muscle that's deep to the rectus femoris is atrophied or shut down, and it's not pulling that suprapatellar fat pad out of the way. So this is an example of an encapsulation or transferability question. It is measuring high-level thinking. It has clinical context. It's more than just recall. So you can take basic questions that are nose, level 1, and turn them into level 2 with a little bit of change and following the basic rules of STEM writing and option writing. The key is the same, the distractors are the same. I've just made this a higher level question just to give you an example. The other thing that's really interesting, and some of you may be doing this, and we explored this a little bit on the assessment webinar a month ago, 2 months ago, whenever that was, is some really interesting data coming out of the Computers of Human Behavior paper way back in 2001, believe it or not. It's almost 20 years ago, 2 decades ago. Actually showing that using multimedia online examinations, again, I was always frustrated with not being able to use these kind of things with my paper exams, other than pictures. And then when you run them to the copy machine, they get twisted and you can't see them very well and you can't have color. But the other thing about doing things online with media and like MS Forms is that you can actually use multimedia, pictures and videos and graphs of signs and symptoms of conditions, of MOIs, of fractures, right? Whatever. This study actually found that using multimedia online examinations, the students found that the assessment more closely matched the material taught, because if you use media in class, then it makes sense to use them in an exam. The use of multiple sources of media actually aided student recall. So the recall was better. They performed better on an assessment. The questions better reflected real-world situations. They were more authentic, students felt, because they're seeing videos and MOIs, et cetera. And they actually reported that it helped them learn. So from a standpoint of assessment for learning, good assessment should always drive learning. Students reported that it actually helped them move their learning forward by changing the way they asked questions and the way they considered why they got something wrong or why they got it right versus just factual recall. So by all means, use Qualtrics, use MS Forms, use other media to implement different forms of media into your assessment instead of just words on a piece of paper. Okay, so that brings us to just a little bit over the end of part 1. So what I want you now is take your phones out, take a picture of this QR code, and it'll take you to, I gotta do the same thing. There we go. So MS Forms is provided with part of Microsoft Office 365. You may have an institutional application to it. Maybe it's free, even if you don't, if you have your own account. So if you have access to this, you should be going on here now. And what you see, wait, gonna back up here, is a quick quiz. All right, what I'd like you to do is take that quiz, because I'm going to show you what you can do. I'm going to leave that QR code up for a few seconds. Take that quick quiz. Don't worry about what you get it right or wrong. Just go ahead and apply answers. And again, if you have your phone, it should come up on that pretty readily. And answer the questions. You see we have some multiple choice, again, with 3 options, 2 distractors and a key. Okay, and then we have a couple with 4. Just to show you that it is okay to use 4, not limiting you to just using 3, and then hit submit. And then I'm going to go to that form and see how we're doing. So we got 26 responses. So, and my slideshow for now. And gotta go back to share screen. Bada bing. Okay, so Oliver, do you see my Microsoft Forms?
Yeah.
Okay, so 26 people respond, that's fine. So this is what it looks like. I can set this up so that I get emails every time someone responds. I didn't because we'll do that for the next thing. And so let's say the window is done and I'm given my quiz. I'll have emails come into my inbox that tells me when someone completes it. And that's kind of annoying because it's one by one. But you can do that if you want. And then I go into this and there's the quiz you just took. All right, and we're going to go and show you how to make this in a second, but it's real basic down and dirty quiz, multiple choice, 10 points. I gave 2 points to each question, kept it real simple. You can see here that there's a star next to each question, which means they're required. Right? You can see there's a point value here, which I can put in or not, depending upon what I want to do with the exam when I make it. Oh, now we're up to 44. Wow, some people are entering real quickly. So if I go to responses, you can see here that I have question by question bar graph of what percentage of questions got it right, got it wrong. Right? You can see here that based on the evidence, what is the suggestion of options of multiple choice? You can see here that I have 0 people selected 4, right? You think, oh, geez, Paul, what a bonehead, right? So what does that tell you? It tells you that I have the wrong answer key, right? So I can see this. I can click 4, say, oh my God, right away, no one got this right. Man, this is a real important part of my class. 43 of my students got this, thought it was 3. What a bunch of dummies, or I'm a dummy, I didn't teach it right? But no, I actually see that I do have the wrong answer key here. I can simply go back to the questions here, and I can change the answer and make that a correct answer. Click on number 3, make it correct, and I go back to the responses, and it automatically updates my data. So I'm like, whew, okay. Most people get that point. 3 is the ideal. Okay, so I can go through question like that as a whole, and you can see right now we've got 45 folks that responded, and see how we're doing. Oh, good, right? 96% got this right, 64% got this right, blah 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 blah. And I can go into each question. Let's say, oh, geez, only 29% got this one wrong here. Let me go into this one. I can do more details. So if I asked for your name, which I didn't, your name would be here, right? And then there's your responses and see who got it wrong, who got it right. Right? So I can see student by student response there if I need to or want to, okay? But I can go in and look, and maybe I put the wrong answer again, okay? So I can make that change if I want, right? Now, here's the other thing that's really cool. So as you see here, I can always do this. I can always download all my data to Excel. And then you have all your data, you have your scores, and you have basically, what you have in the Excel is you basically have one of these charts in a row for each question, right? Each student and how they did, and then their final score at the end. So if you're happy with all this, right, you correct it, make sure everything's correct. Let's say I go through all 5, and I'm not gonna do it now, but make sure all 5 are correct, right? Okay, the correct. I get the right score sheet, right? The answers are correct. I'm done, I can download. But I can also do this. I can review answers. And you can see student by student. So here's your formative feedback, especially if you're doing it for progress testing. I can go to student 1 here, right? And I can look at each one of their responses and double check. Auto graded 2 points. Yep, auto graded 2 points. Yep. Oh, I get here and go, they picked homogeneity. Now I can go and look at this question, read it, and look at the answer and go, okay, no, that's the right answer, right? And let's say, for example, that I screwed up. Let's say, for example, homogeneity is an answer, right? So parallelism is the answer, right? I made parallel into a word just for the sake of this. Let's say in rereading and reconsidering this question and this student's response, I go, you know what? That's a bad question. I can see how they got homogeneity. That's actually a correct answer. I can do one of 2 things. I can go back and change the question and provide multiple answers are being correct. So let's say I want to do that. Let's say I find 5 or 6 kids got question number 2. Well, excuse me. Let's say I determine that question number 4 was bad. It's a bad question, or I have more than one correct answer. I'm like, oh man, I screwed that up. All right. I can go here to the question. I go back to number 4, right? Make this multiple answers, right? And then click on the 2 answers that are acceptable. And it'll auto adjust the scores. All right. Now, the problem with that though, is I didn't say select all that apply. All right. So in this case, I'm not going to do that. Okay. Which you can do. You would write select all apply if I want to do that. All right. So I'm not going to do that. All right. I'm going to go back to the responses, right, and review answers. Again, here's student 1, Susie, respondent 0, right? And I go down to number 4 and I say, you know what? She's right. Homogeneity is valid. I can override that. And I give her 2 points for that, right? So the system, the form software graded it as wrong because I set it up that way, but I'm overriding the score, right? And then now Susie gets the points as needed. So it's really quick. And then I'm going to simply go from student to student by clicking on this right arrow. And I can end up going through everybody's exam. Here's how long it took them. Here's their score. And I can override their points. And that'll automatically adjust the overall scores, right? I can also go question by question, right? So I can do it this way, based on a strong evidence. So let's see, it was question 4 that I had a problem with, right? I can do this, and I can adjust. So one person put homogeneity, I gave her 2 points. I can adjust the point values by question. So it's actually pretty quick, pretty easy once you kind of get the hang of it, of fixing your mistakes, of giving points to students who deserve it, right? And then when you're done with all that, let's say I went through every student's scores, I adjusted them, I hit post score, I click all, and I hit post scores. And you guys would get, if you're in my class, you would get an email. Your individual score, and this is what each student would get. They'd get this, and their name would be on there, of course. Here's their, right? So now they have the test, right? They have the answers, they have how they did, they have the one that's wrong, right? And they can use those. Now, if I don't want them to have that, because I'm going to use the questions again, I don't post them, right? So you have the option. Right? Now, the other thing with review answers is, let's go here, right? So this is Susie. I gave her points for homogeneity. I can tell her why. You know, Susie, that is a great point. You are correct in that homogeneity can be, valid, whatever, right? So now she's getting that direct feedback. When I post that score, she's getting that direct feedback. So if you're using formative and progress testing, you can provide direct feedback on all of your questions. Okay. I need to share my webinar to go to the next part. Share. All right. Can you folks see that next QR code? Oliver, can you see that next QR code?
No, you might have to. Is it on your presentation?
Oh, yeah, that's right. What do I got to do to fix that? Oh, I got to new share. There we go.
Yeah,
now?
Yeah.
Okay, good. So folks, take a picture of the second QR code. And we will do some stuff together. So I'll give you a couple more seconds to snap that pic. Okay, and then I want to share this one, desktop 1. So can you see my browser again?
Yeah.
Okay, so now here we are. Oops. Now here we are in a blank one. Okay. So sample, making a quiz. So what I have is one question, right? And I have a picture, obviously, of a dislocated patella. Right? So here's that using multimedia. I have a little scenario, so I'm combining things here. So a little higher level thinking. So now we're getting to the little more than knows what, right? And a soccer player goes down, grabs the left knee, you run over, you see this presentation based on a presentation of what's your #1 diagnosis. So now I'm doing a little more knows how, a little more level 2 of Miller's, right? And there we go. So there's the first question. So now from a making standpoint, you can do this as we go. Those of you who are logged into Microsoft Forms, add a new question. If we're doing multiple choice, click choice. Okay. And you can type in your question. What day is today? Right. And you can, in this case, you see it adds all for you. So there's some auto fill features. Right. And if you want it to be required, you click on required. If you want multiple answers, as if we could have multiple answers, right? We could then go through and collect and select all. So basically, the student, if we wanted to, again, just to save time, right? Obviously, in this situation, right, and then we can change the point value. Maybe we want to put 7 points in there, right? So the student, to get this question right, they have to click on all 7, and it's multiple. Again, I told you, try not to do select all that apply. But there are contexts in clinical, the more higher level reasoning you go, I think there is a need and use for all that apply with decision making. Right? Now, I have learned this, that there's a problem with putting 7 points in here, is because when you select up here, so what you would do here is, you would have to do this, right? When you do a multiple answer, when you have to tell them that, right? The problem with this, they see the 7 points when they see the test. So if let's say it's a 4-point one. So what I learned is, don't put the points in when you make the test. Put the point values in after the test is taken. The system allows you to do that. So this is a cue that there's 7 answers, right? So I would leave that blank in making this test, okay? All right, now let's add a new question, and you guys can do this as you go along, all right? Making a multiple choice. Let's say we want to do a multimedia question. Click on the Insert Media tab over here. Right now, this is easiest when you have everything available on your desktop. It's a little more clunky when you're driving stuff off like a OneDrive or a Cloud Drive or something, because it works right away sometimes, and sometimes when you go back, it's not there and you have to reboot it or something like that. So I'm not totally satisfied with the functionality of this, but what I have found is that if you drag the pictures of videos you want on your desktop, it works better. So if I click on image here, right, and I say where I want it to go, I go upload. I'm going to go to my desktop, and I got a bunch of pictures. I'll make sure that's the one I want. All right, so let's say that's the one I want. La-di-da. Okay, it loads up. All right, and then I write my question. So what is the most common MOI for the injury depicted? Now, most common MOI, right? That's a problematic question. I hope you picked that up, right? Because some students might say hyperextension, some might say valgus rotation. So you are setting up a problem here with phrasing the question this way, unless, here's the context, you specifically have taught it. So unless you believe, and the epidemiology says that the most common, and you've told your class that X% of MOIs of this injury are valgus rotation, weight bearing, contact or non-contact, whatever. So again, the way you word these questions does have context to what you teach, the content you use, and the data available to you, right? So then you can fill in your options here, and so here's the problem, right? Well, it's not a problem. Here's a challenge. You could, again, I'm going quickly here, and you guys are a lot smarter to figure this out. And if you have an option you don't like, you hit delete over here, right? So, we have overlapping things here, right? We have valgus collapse, we have valgus rotation. Clearly, bad response options here because it's overlapping, right? But you can obviously use as many as you want, right? You can put a video in here. And then here's the thing. So you can build off this question, right? Your next question can be, assessment, right? What would your first assessment step be, right? Or you could add another question that has something to do with this one. You can build off these questions really well. Where's the one I want? There it is. All right. So again, you can make the question a little more clinically relevant. Again, I'm not taking the time that I would to order this correctly, and I'm just trying to show you the mechanics of how to do this so that you can build a reasoning case-based exam assessment module. And you're going to ask about the name of this test, or you can ask about the specificity, sensitivity, likelihood ratios of this test. You can ask, maybe put this test first, and ask what the MOI would be. So you can do that. And then, of course, what you would use for different cases is you would do branching, right? So if you ask for a diagnosis, then you can branch based on the answer. So that means if I were to ask for, the tissue involved here, let's say I had a picture of an MOI, right, a guy planting, rotating, and I say, what's your diagnosis here? And I have 4 options. And you use branching. Option number 1 is ACL, option number 2 is PCL, option number 3 is fractured fibula, blah, blah, blah. Based on their answers, I can set up a series of questions on branching, which directs me to the next question that's built to the answer they provided. Right? So that takes a little time to practice, but you can branch and build case scenarios here, right? You can also, when you're done, this is highly advisable. When you're done, let's say I build out this knee scenario, right? What I want to do here is add a new section, right? Which then, when they go to a new section, they can't go back and change their answers, which means it's the end of the case, right? So it's kind of like Qualtrics adding a new page, turn the page function. You also see here that there's rankings and Likert scores, right? And I haven't really done anything with Net Promoter Score. You can upload files. They should be on your OneDrive, so you can upload files if you want to. So those are a little bit of the build and the questions. And again, you can do, as you see, again, we're talking about multiple choice, but you can add text questions, right? Open single response, best answer response, right? And then you would add the answer here. So if you asked about what the diagnosis is, you can actually type in the answer. The problem with that, though, is the student has to write in the answer the same way you wrote it in order to be corrected. ACL capital letters. If they write ACL small letters, if they write anterior cruciate ligament, right, the system won't score it correctly. But I already showed you how you can overscore that. As you go through and review each student once, you can actually add the points back, right, based on their answer. So you can do that. If it's a simple answer, it'll save you a lot of scoring, which I would recommend. And of course, you can add point values as well. The other thing you can do is you can add ratings, right? You can add stars, different levels, you can add numbers. You don't really do that for tests. It's more for a forms thing. Got a question you don't like, you can hit delete. If you want to move a question, you can go up or down. If you want to copy a question, you simply hit this icon here. So a lot of playing around. It's really pretty intuitive. All right. So once you're done with your test, a couple things, and before we wrap it up, is you go to settings, right? Shows results automatically, which means the student can get the results as soon as they're done, right? But I do that and I tell them they're not final because I have to then go in and fix some questions and provide points to make sure everything is good. So you may turn that off, right? Because you don't want them to see the results and flip out until you've adjusted the exam. So you can do that on off. Anyone can link respond. I did for you guys because you're outside of my system, but I click on this one for my students because it's an Ithaca college system. So they can only respond once and I get their name. They don't have to, if I do this, you don't have to have a provide your name box. Sometimes I do because I forget that, but then you can have a start and end date. You can have a shuffle questions. I wouldn't do that if you're using cases and using sections, but if you use just 25, 50 questions and it doesn't matter, you can shuffle them, which means every student's going to get them in different order. Right? So maybe something to, and then you can add a custom message like, hey, I'm going to go through the exam and, fix questions and add points, yada, yada, yada. I'll post your final results by tomorrow, whatever. And then you can click on this so that they get it. If I were to do this, if they're in my system, I can send an email receipt to the respondents, which means when they're done, they get emailed, they know they've done it. And that's a good peace of mind thing that they've submitted and exams in. And then I can click this on or off that I get an email if I'm expecting a response. And then the last tab is share, right? Only people in my organization can respond. Anyone with a link can respond. I can cut and paste a link. I can use the QR code. I can embed it somewhere. And of course, if it's in my system, I can go right to email, which is pretty nice. And it takes me right to my email system, which opens up. There's the link, and I would type in my students or my faculty or my alumni, whoever I'm doing it with, and hit send. I can write a note if I want. So that's a nice user ability there as well. So here you can see all of your responses. So I had clicked on the email to get responses. I can see in my email that I have all these responses, and I could go to one of them and simply click on the view, and it brings me to here, and it shows me the data. So it reminds me that I need to go in and evaluate an exam that I gave and post scores and everything else. So with that, I'm going to go back to here. And did you see my PowerPoint again, Oliver?
Yeah, we can.
Okay. So there's Quick Strike 3. Oliver, if you would launch that, please. So just 2 questions this time, pretty quick. Does your program use summative assessment in some capacity as either a graduation requirement or as a qualification for board sitting eligibility? And if so, if it's no, you don't have to answer number 2. If so, how do you guys go about doing it? What kind of resources do you have or use in order to assure, deliver an acceptable level of reliability, validity, and generalizability, because they're high stakes, right? So you can always get challenged. Eventually, you might get challenged with a student who doesn't pass, and they want to know where your data is. So 5, 4, 3, 2, 1. Close that one up. And what do we got? So 63% yes. So of the people who do have high stakes exams, 8% use a service, 30% do it internally, and 48% do nothing formal. So that's really interesting. 15% not sure. So that's some really interesting data. If you're using summative measures, this and programmatic assessment webinar, I think, and all the expertise of folks in medical education that do this for a living, that know way more than me, is really, really important to provide some validity and meat and evidence behind the weight that you're putting into those assessments. And this quote from David Budd back in 1995 probably sums it up best. Students can do with poor teaching, right? They learn themselves, they learn from others, and it takes a village kind of concept to deliver, but they often can't escape poor assessment, right? Grades, GPAs, test scores. In medicine, obviously, it's important for residencies and rotations and et cetera, but it's a form of cultural capital, right? Your GPA, your grades, your scores, pass the BOC exam or not, you can't practice, you can practice. So we really need to dig a little deeper into, coming up with assessment measures that don't put us in this situation, right? Where students are really creative, and you could literally argue right there that, number 2 is correct, and number 3 is correct. Number 4 is correct, right? So a little bit of humor there, but we want to do the best we can. And I think we professionally we're obligated to at least make some more efforts to do that. So I hope I've provided you with some information that gives you best practices, insight, tips, and tricks to increase your validity, increase your discrimination, and if you do so, you increase your generalizability. So generalizability theory is, does your sample, your assessment, your test, your summative assessment, whatever it may be, is it generalizable to the larger curriculum that you've taught and challenged that student with? Is it generalizable to scope of practice, right? So how generalizable are your results? Obviously, there's interconnectedness there with validity, reliability, and also with ways to better discriminate students, their abilities from a standpoint of what they've learned. So I want to thank Oliver for all his help in the background, and Glenn for inviting me, and the BASRAT folks and WFATT for inviting me to do this. It's been a great joy. And so if we have, more than welcome to stick around as long as needed, if I haven't put everybody to sleep and anybody's left out there, to open questions up, anything that I didn't cover, or anything that you'd like to develop or discuss a little bit more. And I'll be happy to send this to you folks as well. I know it's probably too small to see, but you can go ahead and grab a screenshot of that for your own purposes as well.
Thanks a lot, Paul. That was an awesome presentation. I think you did a great job. I don't know if you can see the Q&As on your screen. We've had them sort of prioritized by people hitting a like button. So if we have a few minutes, I think, that we can answer some of these questions. Want me to read them out to you, Paul, or can you read them?
Let's see. I can see them now. Clear STEM items. Clear STEMs. What if the instructions are for students to select the best answer, not just the correct one? Well, to me, it's one and the same, right? If you have a best answer, that means you have more than one correct answer, right? because best means one's better than the others. So if you have more than one answer that can be argued to be correct given context, then your validity is going to go down. Your biserial index numbers are going to be really poor. You're not going to discriminate between high performance and low performance. So you have to have one absolute. Think about a national board exam, right? Medicine, AT, PT, right? If the challenges and issues that would come if 20% of the questions had best and better answers, right? It's going to create some chaos, right? Keep in mind, though, that summative measures like this, written pen and paper exams or online exams, are but one measure, right? This is part of the big calculus of programmatic assessment. You should have workplace-based assessments, you may have OSCEs, you may have standardized patients, you may have proficiencies and competencies measured in the clinic, you may have or practical exams. You have other measures to assess competence from a global perspective. So there's no such thing as one perfect artifact for assessment. Please remember.
One from Camry Sigmund here. We've got 13 likes on that one.
What's the question? Go ahead and read it for me.
Several of these types of questions are commonly used on board exam, GG, all the above, select all that apply, etc. So I know many faculty use these as a way of preparing the students to answer these types of questions. Any advice on how to prepare for these types of exams without actually violating the validity of these questions?
That's a great question. And we have the same conversation in-house, right? And full disclosure, we do it because according to students telling me over the years, the BOC exam has a lot of select all they apply. To your point, Cameron, very well said. So to be honest, we throw in a few in some of our progress tests, but I tell them, I said, look, these aren't psychometrically sound ways to present questions. Now, again, there are times when those are appropriate, right? But then probably the content of that question can probably be assessed in other ways. But you're not going to discriminate well between good students and bad students, high performance and low performance, when you use a lot of all the above, none of the above. The most simple answer is that it doesn't give the ability to show the student understands why all of them are. Right? It also doesn't understand the context of why they all are. Right? If you think about when you ask a clinician, an expert, a preceptor, what would you do in this situation? And if the answer starts with, well, it depends. Right? How often do you tell a student that? And your response is, well, it depends. If this were the case, I'd do this. If that were, right? That's context. Right? So those are the complexities. Those types of complex things need to be assessed in other ways, right? Clinical reasoning measures, right? Scripps concordance testing, other diagnostic reasoning assessments, right? Extended match questions, clinical reasoning MCQs, and not just short cut and point low level. You're getting up to level 2 of Miller's pyramid there. So if you're trying to assess what you teach, right, and how effective you are, again, go back for programmatic assessment, then don't do it. If you're trying to prepare them for the BOC exam, throw some in there and explain to them you're going to have somebody, so get used to it. And then go through the rationale behind why these could be acceptable. And I think what you found, at least in my experience, when we go through this with some of the prep books, the BOC prep books, is you end up rationalizing and analyzing each possible answer. And what that means is you're saying, in this context, this one is correct. In this context, this one is correct. AKA, you're teaching them how to take an exam, right? You're not teaching them or assessing their actual knowledge germane to that domain.
I think that sort of answers the question you have on the from Aaron about the BOC having 4 multiple choice questions. I think that answers that question. Another one, James Pierre Glode, do you make decisions on keeping versus discarding items after every time you administer that exam, or do you make a determination after multiple cohorts have taken that exam?
Hey, James, good to have you on here. Actually, a little bit of both. So we don't have summative assessment, so that's a luxury, I guess. So there's less pressure, right? So we don't have students take an exam and get X score, right? The other question, those of you who do summative assessments, right? How do you determine the pass score, right? And actually, what I learned at European Medical Board class in Maastricht is the average is like 63%, right? And again, there's ways to do that way beyond my ability. But how do you determine the cutoff score, right? What passes and what doesn't? And if you have a passing score of 85%, 90% on a summative exam, and you don't have evidence to show that you have validity and great BPI numbers, your score is meaningless, right? How do you determine that score? So there's a lot of intersections there. Psychometrics people can help you deal with it. But to get your question, James, if it's below 0.20, I throw it out. I either throw it out or redo it. However, there are some questions where I know for a fact that I taught that point blank, I can't think of something top of my head under pressure, but it comes back to your culture, your class, right? If you know you taught this and it's important to you and you said, you guys need to know this, write this down, right? And still a bunch of them got it wrong, context. I'll ignore the BPI number, the by serial index number, because I know I taught it. It's in my notes. It's in the PowerPoint. I said it 15 times, but I'll come back to class that next day and go, hey guys, only 10% of you got this one right. You have to know this, right? This number is blah, 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 right? But from a standpoint of the database, the test bank, I'll retweak them and then re-give them. And then I'm going to process, this is a live process ongoing right now. Then next time I give them, I'll look at that and see if it's got better. Right. So there are test bank companies, by the way, online that I'm investigating, see if we can afford to do it, that will do a lot of this for us, house them and administer them and run these numbers for us. Since I've started doing this, I've gotten probably emails of online test bank companies and assessment companies that will do a lot of this work for you. Let's go see if we can afford it. Again, as that resource thing, given a small program and how much the cost is. So it depends a little bit of both, James.
Okay. Quickly, how do you control cheating on the online testing?
Right here, we do it on Zoom. So I've only done it once. My final exam for assessment this May was given online. I did it through forums. I took my existing exam, modified it, made it forums, added the media stuff, did everything I could to make it better based on what I had. Questions from my test bank that have been used and been vetted. Start with all the good ones, to James' point. Try to improve the ones the numbers are lower. And then we put them on video, and I sit here and I watch. So there's an interesting conversation on the Educationalist Den Gather community of NHA about this. How do you do this? There are online services. They're very expensive. But each student was allowed to have one piece of paper. If they have to work something out and write it, they showed it to me before. They had to prove to me their phone wasn't anywhere near them. They're on video. I see the whole screen, and I'm here. And what's funny is sometimes I do this, and they don't know if I'm watching or not. So they're taking the exam, and they don't know if I'm staring at them or not. You may say that's suspicious or whatever, but in the end, there was no evidence in the scores, the examiner scores, that anybody cheated. They were consistent with, and I have the students for a whole year. So the spring exam, the scores were consistent with all the way back to August. High performers, middle performers, low performances. So it's not foolproof, but neither is me sitting in class, working on the score sheet, the Scantron or something else while my students taking an exam, and me randomly looking up. So,
yeah, just a quick note. I've got a little document, a policy document that I get to my students in terms of what they have to be able to have in place and how to do it to do their Zoom. And I also have one of my TAs he works as a proctor, and his or her sole job during the exam is just to watch the people. And every so often we'll go into their audio to make sure that there's no speaking, because they could easily have a phone sitting there talking to one of the other students. So they'll go in and listen for anything that's audio.
Yeah, it's one of the limitations. But, I do most of the stuff, guys, with progress tests, which are no stakes. We started this year, and I do a 25-question progress test, for example, on shoulder. We got done with shoulder, and I don't know, maybe 15 questions. 15 key things. Some were anatomy, some were orthokinematics, biomechanics, some were diagnosis related, and then use pictures, use videos. Boom, I send it out at night. It takes me 15 minutes to make it. Send it out and said it has to be done by Thursday at 10. It's homework points, so they got to do it. I get the emails that they're done. I go in, and then I correct them, and then next day I go to class, and I go, okay, everybody here got number 10 wrong. Well, come on, I said this 15 times, right? The role of supraspinatus is blah, blah, blah. So it's really, really effective and easy for formative assessment. It's effective too, but you got a lot more bells and whistles and a lot more things to consider. Dan Stigley asked how many student takers are needed to determine exam validity. That comes back to your Richardson, your KR20 validity score. If it's over 0.5, it's good for a teacher-made test. If it's over 0.65, it shows you that the exam itself is valid because it factors in the high performers and low performers and the overall quality of the exam and how many were hard and how many were easy, that kind of thing. So I don't know about how many on a larger scale if you want to determine what's the best number to get, but it's beyond my control. I have what I have in my class. And again, since I'm not using it for summative assessment, there's less weight on me to prove that I have those kind of psychometric data. Can you develop a bank of, Casey asked about a bank. No, but you save all of your tests and you can copy them and redo them. So my shoulder one, my assessment one, it's there. I'll just copy it next year, and then I'll go into it and tweak it, delete some. Now, here's one I didn't say, and I'm glad this came up. the limitation with MS Forms is you can't get that, to my knowledge, you can't get that data that I get with the Scantrons by serial index and the Kepler-Richardson number and the p-values. You don't get those. You have to go through one by one and determine which ones were good and which ones are bad. So there's the problem with MS Forms. So when we go back to real live school, I'll be using the bubble Scantrons again for my midterms and finals, and I'll be using MS Forms for progress testing. Make sense? How do you control cheating? Can you please give an example of partial sentence when writing this down? Oof. Can you give an example of a partial sentence when writing this down? I don't know. I probably could if I had a test in front of me. Not off the top of my head. Maybe it's because I've worked hard to not do that, that I've blocked that out. Would testing and forms be FERPA compliant? I'm pretty sure testing is FERPA compliant and forms is also HIPAA compliant. Different conversations about code. I've seen other people comment on different webinars that MS Forms would be compliant if you were collecting data from students coming back to school and stuff like that, but you have to check with your institution. So I'm not a lawyer, so don't run to school with that. Can you utilize forms through Canvas? Don't know. If you use MS Teams, which we started doing, which is really cool. I have an MS Team for my class. And then I go in MS Teams and I can post those scores directly on Teams. And it's aggregate, right? It's that result that you saw. Each question, what percentage got it right? So it's anonymous. So they get their anonymous results themselves automatically, the way we set it up. And then the class can see on MS Forms, I can share the data just in 2 clicks. So I don't have to remember to email it. I don't have to remember where it goes, all that kind of stuff. If students take exams asynchronously, when do you allow students to view the exams with or without comments? Question of, they don't take them asynchronous. My exams are all synchronous. So my whole class was synchronous but recorded this semester on the fly. So any of the classes were available to them, and we did a lot of open one-on-one sessions, fill-in sessions, that kind of thing. But exams were all given at the same time, but they were able to. So if I didn't have a student do it, I would probably just do the same thing. If they had to do it at 9 o'clock at night, for whatever reason, I would probably watch them. I would have it on, but I haven't come across that need yet. So all good stuff. A lot of stuff about security and administration. Okay, anything else?
I think we may leave it at that then. Paul, I think that was a wonderful presentation. I think you covered a lot of information that will be really, really helpful to a lot of people who attended this seminar and others who may see it later on. So thanks very much for all the work you've put into putting this thing together and your willingness to share with the information. I also want to thank Oliver Coburn from the British Associated Sport Rehabilitators in the United Kingdom. WFATT has graciously given us access to their Zoom platform, and Oliver's expertise is helping us with the logistics of the conference. He also has helped us in terms of disseminating the questionnaires that you'll be getting and the certificates that you'll be getting. So just quickly, the World Federation, we're celebrating our 20th anniversary. We are dedicated to promoting the profession of athletic training and therapy worldwide. And for more information about how to become a member as either a professional association or an academic institution, please go to our website at WFATT.org. Just so you know, currently we have 44 members and we represent 12 different countries on 5 different continents, and that's including 29 academic institutions. So if you're from an academic institution, we really would encourage you to join the association. It's a pretty nominal cost to join the association. And our academic community within our membership is quite active. They have a private Facebook group that they do a lot of interchange with what we're doing, the same thing that we're doing here in terms of sharing. And we want to expand that reach across the globe so that we can all benefit from each other's experiences. Just to let you know that our next webinar will be with Dr. Anthony Breitbeck from St. Louis University. He'll be speaking on interprofessional education, professionalism, and athletic training and therapy. We are scheduling tentatively mid-September, so I will be giving you more information on that as we get the date actually finalized. But keep an eye out on that and look for us on our social media. I really would encourage you all to sign on and like our social media, be it our Facebook or Twitter or LinkedIn, and you'll get ongoing information from us. So please take the time to link into that, and you'll be connected around the world. Once again, Dr. Geisler, I want to thank you very, very much for this great presentation, and the one you did previously as well. I think you've given us a lot of information. It will be really valuable, both from a theoretical and from an applied perspective. So thanks very much for your experience on all of this and your willingness to share. I want to wish all of you the best in these challenging times, and hope that everything starts to work out as things unfold. Please take a few minutes to respond to the questionnaire that's going to be sent out to you so that we get more feedback from you and make this a bigger and better thing. So thanks very much, everyone, and take care. Cheers.